House of Wellness, powered by Himalaya Wellness Company. Welcome to House of Wellness, a podcast powered by Himalaya Wellness Company. This podcast will give you insights on different aspects of Ayurveda and wellness based on science. Himalaya Wellness is a global herbal health and personal care organization with close to 500 products in over 100 countries, bringing wellness in every home and happiness in every heart. In each episode, we will have candid conversations with qualified and experienced Ayurvedic experts on how to take charge of your health and well-being in the modern world. Hello to all our listeners and welcome to another episode of House of Wellness. Today we are speaking to Dr. Guruprasad KV, an Ayurveda expert from Himalaya Wellness Company. We will be discussing diabetes, its prevention and its management aspects. Welcome, Dr. Guruprasad.
Thank you.
Doctor, first and foremost, what exactly is diabetes besides being a lifestyle disease?
Diabetes is a disease that occurs when your blood glucose or blood sugar is too high. If not managed properly, then it may lead to serious complications in multiple organ systems such as heart, kidney, eyes, liver, etc.
So, is it possible to cure diabetes?
It's a fact that there is no known cure for diabetes, but we also know that it can be effectively controlled or managed. However, in some cases, when diabetes is uncontrolled, it results into complications. For some people with diabetes, following a healthy lifestyle is enough to control their blood sugar levels. Diabetes is undoubtedly one of the most challenging health problems in modern times. It is increasing globally. The prevalence of the disease increases with the age. More than 60% of the people with diabetes live in Asia, with almost one half in China and India combined.
Moving on, how does one know if they are diabetic and when should they see a doctor?
Most early symptoms are from higher than normal levels of glucose or sugar in blood, and symptoms like feeling very thirsty, peeing more frequently than usual, particularly at night, feeling very tired, weight loss and loss of muscle bulk, itching around the private parts are frequent episodes of thrush, cuts or wounds that heal slowly, blurred vision. If you experience these symptoms, it's time to visit your general practitioner as soon as possible.
Could you also elaborate on the different types of diabetes, like type 1 and type 2?
Mainly two types of diabetes. Type 1 or insulin-dependent diabetes mellitus, and the treatment involves insulin. Second type is non-insulin dependent diabetes mellitus, and treatment involves keeping a healthy weight, eating right, and exercising, and some people need medication too. Ayurveda literature records main causes of diabetes mellitus as the long periods of physical inactivity, laziness, sleeping for long hours, excess use of food which is heavy to digest like dairy products, aquatic and marshy animals, sugar or jaggery preparations, fresh grains, etc.
Now, you've already mentioned that diabetes can be controlled and is manageable. How can a person in today's fast-paced life manage his or her diabetes effectively?
There are three legs in which diabetes can be managed effectively. Foremost is life cycle management, along with nutrition therapy and physical activity. Coming to lifestyle management, it's a fundamental aspect of diabetes care. Ayurveda emphasizes that the first and foremost principle of prevention as well as the treatment of any disease is avoidance of causative factors. This is first line of treatment. Restrict heavy diets, fatty foods which increases body weight and lipid cholesterol. Avoid sleep during daytime and laziness. Restrict the excessive use of milk and milk preparations such as curds, meat of domestic animals such as red meat, aquatic animals like oyster, new grains, puddings made of jaggery and sugar. The second one is nutrition therapy. Nutrition therapy has an integral role in overall diabetes management. The most challenging part of treatment plan is determining what to eat and following a food plan. Various preparations of rice, which crops within 60 days, barley, wheat, grain varieties, millets, red gram, horse gram and green gram with bitter and astringent leafy vegetables should be taken. Raw banana, amaranthus, bitter vegetables like methi seeds, karela fruit, tenderly, pepper, rock salt should be used. The third one is physical activity. Physical activity is a general term that includes all movement that increases energy use and is an important part of the diabetes management plan. Exercise is a more specific form of physical activity that is structured and designed to improve physical fitness. Both physical activity and exercise are important. Exercise has been shown to improve blood glucose control, reduce cardiovascular risk factors, contribute to weight loss, and improve well being. Practice regular exercise or yoga, increase calorie consuming activities such as brisk walking, swimming, cycling, etc.
And lastly, what would your advice be for our listeners to effectively manage their diabetes?
Let me start with the don'ts here. Avoid food that are very spicy, salty, sour, and also such preserved items, fried food, heavy indigestible foods, too cold and hot, stale food, and the food that do not suit you. Avoid fruits with high simple sugars like banana, chiku, grapes, and mango. Restrict intake of food containing refined or white sugars. Consuming a lot of tea and coffee should also be avoided. Needless to mention that even tobacco, alcohol, and drugs comes under this list and should be avoided. Limit the use of potato, rice, milk products, and oily foods. The do's will be use fruits like orange, watermelon, apple, guava, jamun fruit, amla, etc. Increase the use of barley, wheat, green gram, and roasted Bengal gram in diet. Mental or emotional stress should be tackled. You should find out what works best for you, be it meditation, prayer, sports, exercises, yoga, or any other activities. Physical exercise according to your body condition at least 30 to 60 minutes daily. Take utmost care of personal hygiene, especially of feet and hand. Take care to prevent injuries. Immediately consult a doctor in case it happens. Meet your physician regularly.
Thank you so much for a very insightful session, Dr. Guruprasad. And thank you to our listeners for joining in. We hope this session has helped our listeners and motivates them to take charge of their life. Reach out to us if you have any questions. Visit www.himalayawellness.in and drop your queries in the Ask Your Expert section with the hashtag House of Wellness. Details are given in the description of the podcast. See you all in the next episode of House of Wellness, a podcast powered by Himalaya Wellness Company. House of Wellness, powered by Himalaya Wellness Company.